This essay example, as well as thousands of others, is available in text format on our website for free and without registration. Simply Google Ivy Panda Free Essays.
A physician, also known as a medical doctor or just doctor, is a healthcare specialist who practices medicine, promotes health improvement, makes diagnoses, and cures diseases. Physicians may be differentiated into primary care doctors or general practitioners, dentists, surgeons, and specialists of various departments. In relation to the main concepts, two of them may be considered fundamental: patient-centeredness and physician-patient communication. The former pertains to the idea that patients' needs are of primary importance. All healthcare professionals, including physicians, are expected to be sympathetic, respectful, and responsive to their patients. As for physician-patient communication, collaborative interaction is a must. Patients' health improvement depends on physicians' experience and expertise, but whether patients follow recommendations is equally significant. The profession of a physician is ancient, although it is impossible to identify the exact date. As early as 2700 BC, physicians and dentists existed in Egypt. Homer, about 1000 BC, considered Egyptian doctors to be the best specialists, and Herodotus, the 5th century BC, highly appreciated their professionalism. Other ancient countries could also boast their doctors. For example, the earliest Chinese physician, Bian-Ke, Charaka, one of the contributors to Ayurveda development, and a famous Greek physician, Hippocrates. Thus, this profession was widespread in the ancient world. In the present stage of development, the responsibilities and roles of doctors are numerous. They concentrate on performing a history and physical to determine a differential diagnosis for a patient. The most probable diagnosis is identified. Then, in accordance with the data received, management and individual treatment plans are formulated. Physicians' duties also include arranging sustainable care and administering complexity and risks if the medical case is uncertain. Apart from the role of care provider, physicians are team members who cooperate with medical staff. For instance, they may give referrals to other specialists. Further, doctors act as educators. They explain to patients and their families what must be done to combat the current disease and how they should behave in order to reduce exposure to diseases in the future. Finally, physicians are advocates for patients and families because they help them navigate through a complex medical system and receive the most patient-centered care in a cost-effective manner. These facts illustrate that the roles and responsibilities of physicians are diverse. While both physicians and nurses are significant to medical history, the differences between them are substantial. First of all, doctors are limited to their specialized field, and nurses may work across several wards. Then, doctors bear more responsibility and carry out the decision-making process to a larger extent, while nurses are more oriented to practical tasks and handling patients. As a rule, doctors prescribe treatment, but advanced practice registered nurses are allowed to make prescriptions. In conclusion, physicians are among the most important healthcare specialists. Dated back to ancient times, this profession has acquired new characteristics. The doctor's roles and responsibilities are varied and refer to medical care, teamwork, education, advocacy, and guidance. While nurses focus on practical issues and care delivery, physicians interpret patients' conditions and make decisions. This essay on physicians, their roles and responsibilities was written and submitted by a student just like you. The Ivy Panda Samples database hosts thousands of works similar to this one on various subjects. Visit ivypanda.com to find what you are looking for, free of charge.